Greetings to everyone present here today. My name is Regina Yap Wan Teng, and the title of the study is Attitude Towards COVID-19 Vaccination Program. This is table of content. I'll be talking about the introductions of program and study. Program Attitudes Toward COVID-19 Vaccination was held on May 22, 2021. The participants are a targeted community of residents from Rumah Panjang Stanley Jenlian, Penasu, Cebu, Sarawak. The aim is to encourage attitude change toward COVID-19 vaccination among the target community. My Sejahtera disclosed that few states located at the east coast side of the country and Sabah has the least percentage of registrations. East Malaysia has low inoculation rate since the starting of the vaccination program in March 2021, especially in rural areas. Malaysian acceptance level and attitudes towards COVID-19 vaccination is still a debatable issue, especially in rural areas. Youth attitude change approach is used to ensure higher possibility of effective persuasion through various communication sources, message contents, and channel. The objective of the program is to spread and increase awareness about COVID-19 vaccination in the community. In addition, it is to educate the community about the importance of vaccines. The introductions of the studies is divided into two objectives, which is to identify the difference between affective behavior and cognitive components of attitudes toward COVID-19 vaccination during the pre- and post-program. Besides, it is to identify the difference in overall attitudes towards COVID-19 vaccination before and after the attitude change program. I will be talking about literature review. Before COVID-19 pandemic, vaccination had long been an emotionally charged issue among many communities, especially among anti-vaccination groups, which manipulates emotions by promoting misinformation and conspiracy, which might not be true. This resulted in divisions and confusions. Therefore, it leads to vaccine hesitancy and reductions in vaccine uptakes, especially among communities with ethnic minority background, lower annual income, lower level of education, poor knowledge of COVID-19, and poor compliances with government COVID-19 guidelines. According to WHO in 2020, stated that vaccines uptake was increased by encouragement and social pressure from people that an individual respects and trusts. Next, I'll be talking about hypotheses. There are 4 hypotheses in this study. The first hypothesis is there is a significant difference between the affective components of attitudes toward COVID-19 vaccination during pre- and post-program. Hypothesis 2 is there is a significant difference between the behavior component of attitude towards COVID-19 vaccination during the pre- and post-program. The third hypothesis is there is a significant difference between the cognitive components of attitudes towards COVID-19 vaccinations during the pre- and post-program. The last hypothesis is there is a significant difference in overall attitudes towards COVID-19 vaccination during the pre- and post-program. That's all from me. Thank you so much.
Greetings to all, my name is Wong Huan, and next I will be talking about the application of Yale attitude change approach in our attitude change program. Yale model is introduced by Hofland, Janice, and Kelly. The basic model of this approach can be described as who said what to whom, with what effect. The purpose of the attitude change program is to examine the attitude change of target community members toward COVID-19 vaccination, and it has implemented Yale attitude change approach. The audiences of the program are residents from Rumah Panjang Stanley Jelian, Cebu, Sarawak, while the program was conducted through online video communication platform of Google Meet. Next, there are some main activities in the program where all applied the Yale attitude change model. So first, for the online talk, the credible source was a doctor holding the position of the head of family medicine unit in UMS. He's also the head of vaccination program in UMS. The doctor has delivered messages such as types, functions, importance, and effectiveness of the vaccines. And in results, the source has successfully increased audiences' understanding toward the vaccines and helped to organize their uncertainties heard from other sources. Next, as for the video presentation slots, organizers intended to share information to the audience regarding the steps to register for vaccination using MySejahtera apps for self and dependent, and also the advantages of receiving the COVID-19 vaccine. At the end of the slots, audiences understood clearly on the steps to register for vaccination and also the advantage of receiving the vaccines through the straightforward and easily understood visual ads. Besides, a sharing session by a community member from the Longhouse was also conducted. The community member is a dental technologist at Clinic Pegigian Jalan Oya Sibu who afforded early access to vaccine. He is a trustworthy source with personal experience of receiving COVID-19 vaccine, and he has shared on the experiences like procedures at vaccination center and the mild side effects he experienced. Audience seemed to trust his words as they kept asking for his advices, hence positive attitude change was likely to occur. Next, there are few topics to be discussed under method to conduct the study. First, the study has adopted quantitative-based cross-sectional survey method so that it's easier for the researchers to look at a population at a single point of time. Survey questionnaire was used to collect numerical data and within subject design was applied as same participants were involved in both pre- and post-program study. Participants of the study was 30 residents from Rumah Panjang Stanley Jillian who joined the Attitude Change program on May 22, 2021. Location of the study is at the Rumah Panjang Stanley Jillian, a longhouse in Penasu, Sibu, Sarawak, Malaysia. That's all for me, and I'll pass to my teammate for the further discussion on other topics under method. Thank you.
Greetings to all. My name is Nur Aisyah binti Mohamad Firus and I will continue with research procedure. So after the pilot study was conducted and analysed, actual study was conducted on the day of the attitude change towards COVID-19 vaccination program. A group chat was made in messaging application which is WhatsApp prior to the program in order to enable effective communication between the participants and researchers. Two sets of questionnaires were made and distributed by using Google Form to assess the pre- and post-program attitude of participants towards COVID-19 vaccine. The pre-program questionnaire was distributed before the program started, while the post-program questionnaire were distributed after the program ended. The data collected then were analysed using IBM SPSS 27 and tabulated to report in full paper. For research instrument, we designed the self-administered questionnaire to measure the attitude towards COVID-19 vaccination and was constructed in Google Form. The questionnaire consists of demographic questions and three main sections, which represent three skills of the instrument, that is affective component, behavior component, and cognitive component. There are 10 items for each skill and a total of 30 items of questionnaire design. A 5-Likert scale was used to indicate respondents' level of agreement towards each item. The same questionnaire was distributed at two different times to act as pre- and post-program questionnaire in order to measure if there are any significant changes of attitude towards COVID-19 vaccination among participants. Online approaches, which is WhatsApp, was used in order to collect data from the participants. The 30 participants from the targeted community were told that the pre- and post questionnaires were used to assess their attitude towards COVID-19 vaccination and that they were required to answer as truthful as possible. Then, the immediate collection of the questionnaires after the program ended is to ensure any attitude changes after the program could be immediately recorded. That is all from me, and I will give to the next presenter for the result. Thank you.
Hello, my name is Yusmariaziani Binti Yusri and I'll be presenting our findings. So according to the table, participants belong to age group 16 to 25 years old has made up the largest portion, which is 40%. And among the participants, 68.3% are Bumi Putra Sarawak. Additionally, 56.7% of the participants are Christian. As for working status, 56.7% have claimed that they are students. Noting respondents' education level, 40% of them claimed that their highest education level was STPM, Diploma, A-Level, Foundation, or Matriculation. For reliability for pre-program, the affective behavior and cognitive skills have showed very good internal consistency and high level of reliability. The overall pre-program instrument has reported Chromebox alpha coefficient of 0.986. As for post-program, all scales for affective, behavior, and cognitive was found to have good internal consistency and reliability as well. The overall instruments have reported a Chromebox alpha value of 0.938, and through the data analysis, both results indicated a high and excellent level of reliability as suggested. The validity was assessed using Pearson correlation, and the pre-program results showed that there was strong, significant, and positive correlation between pre-program affective, behavior, cognitive, and overall attitude. This same goes to validity results for post-program, where all components showed significant and positive correlation as well. For PET sample t-test, the analysis result for PET sample t-test showed that there is a significant difference between pre- and post-program affective, behavior, cognitive, and overall attitude. In addition, the mean score for all components including overall attitude for post-program can be seen higher than pre-program. On that note, hypothesis 1, 2, 3 and 4 are accepted. To discuss, for the analysis of PET sample t-test, comparison between pre- and post-program attitude components and overall attitude has revealed that the participants' attitude towards COVID-19 vaccination had changed significantly as p-value obtained lower than 0.05. According to past research, those who involved in attitude change program very likely to have change in attitude than those who did not. Their experience has a significant impact on individuals' cognitive and affective, which then influence their attitudes. As a result of their involvement in the program activities including talk, games, and sharing session, the participants are more convinced of the COVID-19 vaccine effectiveness. The talk on the COVID-19 vaccination by guest speaker has possibly led to alteration on affective and cognitive components, as the involvement of professionals in giving talks can effectively change an individual's affective and cognition. Our program also included a memory game that attempted to increase participants' understanding on how COVID-19 vaccine function in order to protect humans from the virus. Furthermore, video footage influenced participants' behavior due to the model or content showed in the video. Based on the results, we can say that the activities on our program were able to significantly influence the cognitive processes that will directly impact the attitude of participants towards COVID-19 vaccination. That's all from me. I will pass to my next teammate. Thank you.
Greetings to all, my name is Stephennie Stephenson. I will present the strength and limitation of our study. The strength of the study is having objective that clearly stated. The inclusion criteria is included, which is the resident of Rumah Panjang, Stanley Julian Penasu Sarawak. The exclusion of other participants allow an in-depth analysis on attitude change towards vaccination among targeted population. Thus, there is no conflict of interest. Therefore, the study able to conduct smoothly and successfully achieve the objective. While in terms of limitation, the study has a small sample of size, which is 30%. It is only involved the targeted area. We can say that the size is insufficient to generalize the finding because it may not reflect the various situations in which people's attitude concerning COVID-19. Next, the study was unable to investigate any sleeper effect. The researcher unable to determine if there was an increase in attitude change among the participants. To be concluded, the study shows significant change in participants' attitude towards COVID-19 vaccination. Everyone also should consider getting their vaccine. Therefore, an awareness about the safety and effectiveness of vaccine should be done widely through any various form of multimedia. It is also important to remind people that the purpose of this vaccine is to protect and not to 100% cure. And this is our references. That's all from us. Thank you.